regarded the reference standard. Okay, cream white will be regarded as the reference standard. However, it's important to take note on the aspects she has highlighted on the kind of food one eats, and also the baseline of your teeth. What I mean by baseline is your original teeth as you were growing up.
Yes.
Because if it changes suddenly, then there's a problem. So those are very important aspects that she has raised.
That's why it's very important to visit your dentist at least 2 times a year, because as you know, we know better on these things and we ask questions that you might forget. Okay, sometimes people will say, I think my teeth is like this since birth. But then I will ask questions. Did you remember if you eat curry? Curry is really making your teeth yellow. Tea here in Macau making your teeth yellow. Milk tea, boba tea, oh my. It's really delicious, but then it will make your teeth brown and yellow. Black tea, oolong tea, even soy sauce can make your teeth darker. For other nationalities, betel nut chewing can really make it dark. Smoking, I hope no one's smoking, but the nicotine will also make it dark.
If there's anyone who smokes, we'll remove your name from the church register.
No one will admit then, brother.
Thank you so much. Yes, Sister.
I'm going to ask about
Isabella.
According to my observation, there are some places where the water can affect the kids' teeth when they are growing, especially kids when they are turning, they are less than 2 years. Because I have an experience for the child who was less than 2 and the one who was like 3 years. There's a very big difference on how their teeth turned out, because we didn't know that the water has an effect there. And again, there are kids also grew in the same neighborhood, but others, their teeth are not affected, they're not as brown, and others, their teeth are very brown. Is there like something like genetic or the way they turn? And again, another question is there something you can do? Because the dentist can do so much, maybe sometimes they can say the other teeth are worse than the rest, like the permanent teeth, they can put some things to support them, and they say with time they will get better. But is there something that can be done for them to get maybe brighter or whiter, or it's just like that? And how long are they going to last? Longer, or they bring problems? Is there a difference between normal cavity and a fluorosis one?
That's a lot. That's a whole lecture question. Okay, but I'll try to minimize it down. Okay, first of all, thank you so much for that question, sister.
That's a loaded question.
Maybe if I finished my lecture, it would have been answered. But due to the time, I don't want you to suffer. Okay, so first, fluoridation. This is something that you need to know in your place at the right time. For example, again, in Canada, that year, they created a fluoridation treatment in the school, in the community. So, if you know, and the government told everyone about this, you need to be careful, okay? Because I think we don't have that much problem now anymore, but in case you live in that time, you really have to do a lot of things. The difference between the two is the timeline of the kids. Maybe the following baby did not receive any fluoridation, okay? So you need to figure out, you need to ask the government, your area, what do they have in the water? Okay, so it is best not to drink water directly in the tap water if you don't know the concentration of fluoride, okay? Especially below 2 years old, not too much, okay? The other one, what should we do now? Okay, so many things, okay? But most common ones is to fix it. First, fluoride treatment. Check with your dentist what is the right amount of fluoride that should be given in your child in that specific age and time and place, okay? Second, I have patient in BGC before. Even if they're so rich, they came from Canada. And I remember this case so well. All the teeth have fluorosis, dark spots, white spots, so weak. Okay? Usually, sad to say, we do veneers or crowns already. Tooth filling, sure, if you can patch it, but it will keep on breaking. Again, the base is really weak. So you need to make it strong. The advanced treatment would be just doing veneers, put crowns and bridges. For the Filipinos, they call it jacket. Jacket crown. For the foreigners, these are the veneers and the crowns that you use because you have to cap it with something strong. And then from there, monitor and visit the dentist regularly. Okay? For the other questions, I forgot already, sister. It's so many.
Yeah, I'll let you talk to her on one-to-one. But my interest is, was that the government supplied water or it was water from the well?
Okay, where we are living initially for rented place, the water is okay. Now we bought a land, we built, and we went to stay there. We didn't know the water there because it's a borehole water.
Yeah,
Is it from the land?
Yeah, it's from the borehole. So it's exactly what she's talking about.
Yeah.
Is the chemical composition, the fluorine itself.
And they say it's not only drinking, even
Yes.
you avoid complete even cooking with the cold water because you can think you are doing something, but the food they cook, even the schools around.
Yes.
Okay. So for more details, she's coming back on May 1.
Yeah.
But you need to catch her before she goes into the dental room. We have a makeshift of a dental room, which will be this room here.
Okay, okay.
Behind there.
If we can have a bed, you know, a massage bed.
Ooh.
If there's anyone with a massage bed, better so you can lie down. It would be comfortable for them. If no, it's okay.
We'll see. There's a chair we'll try to use. I don't know whether we can find a bed.
Anyone here who has massage bed at home? Filipinos like massaging. No? I cannot bring mine. I have a beauty center in Macau. I have foldable beds, but it's so heavy.
Yeah, that
Maybe
will be-
better from
we'll
here.
try to use with a few seats that we'll try to use.
Okay,
on that
okay.
day. There was two more. Oh, yes.
My question is, when we drink a hot water, then after that is we drink cold water, it can affect our teeth, and it caused sensitivity or weak of our teeth. And what is the cause also of sensitivity of our teeth?
All right, sensitivity.
Thank you.
Okay. So hot and cold, you cannot mix it.
Yeah.
Okay? It's very dangerous. There's shrinkage, expansion. Even your natural tooth will suffer from it. You know, if you've been to different places with winter and railways, their metals changes, right? During winters, it shrinks. During summer, it expands. Same goes with the teeth. That's why you cannot, for example, Filipinos eating hot bulalo, hot soup. Suddenly, there's halo-halo on the side, right? This is very common. Sweet drinks, cold drinks. Drinks the soup, eat halo-halo. Oh, I remember I have bulalo. Drinks again. No. It's very dangerous. It will break the tooth. It will cause sensitivity. But there's one thing. It's in my slide, but I'll just discuss. Lemon water. Who drinks lemon water here? Because you tackled the sensitivity. Who drinks lemon tea? Soft drinks? Coffee? These are acidic drinks. If this is the only time that you should not be brushing right away. Why? It will cause sister sensitivity. Why? The acidity of the drink, especially lemon drink, will put acid on the teeth, will soften it a little bit temporarily. Okay? Then, if you brush away, can you imagine? You're just removing away your enamel, the part of the tooth. Then now, sister, you have sensitivity. Okay? Moreover, if you drink hot lemon tea, okay, together with the acid, melting it away, now the hot water is attacking right away on the tooth, causing the dentine, the yellow part inside, to be really sensitive. So mind you, when drinking acidic drink, vinegar, maybe paksiw, don't brush right away. Wait 20 minutes to 30 minutes before brushing so that you will keep your teeth healthy.
Yeah, thank you so much. I hope we had an image of the parts of the tooth, because what she's explaining basically would be very clear. She's very clear actually about the layers. So if you have sensitivity, it's not a good sign. Yeah. It's not a good sign. Now, by the way, this is just a tip. The explanation of cold, hot, cold is actually very dangerous. If you are from jogging, don't go straight into a cold shower. Yes. No, if you want to die fast, do that. Okay?
You will be young forever.
Yes, so please don't do that mix. I think that was the last hand.
I think she's
yes.
waiting.
Oh, okay.
Yeah, I actually have a picture of that, but I cut it short because of the time. Yeah. Last one, please.
Yes, I am just really very curious if it's really gingivitis or a serious one. Because every time I brush my teeth, there's a stain of blood that goes out in one of my gums here in my upper part, frontal teeth. So it is really serious because it's my lucky day to ask you straight because here is quite expensive. I go to the dentist.
Yes.
So
That's
thank you
why
for
I do
giving me
free.
a chance.
Yeah, that's why I do free checkup. So in case you have any questions, even if you don't do it with me, I hope you do it in the dentist here in Hong Kong because Macau is there's a little bit of distance. But to answer your question, sister, first, gingivitis is just the beginning. Usually, gingivitis is the mild form. Okay? Gingivitis doesn't have to bleed. If you have inflammation, itchiness of the gums goes a little bit, maybe 2 millimeters below the gums could be gingivitis. But if it goes beyond that, bleeding gums, doctor, every single time, there's a more severe case. I did not discuss, maybe because it's too technical, but we call it periodontitis. You can look it up on Google after, periodontitis, meaning you have infection not only on the tooth, not only on the gums, but it's eating the bone already. Okay? And the infection, the bacteria is inside, wherein you cannot clean it anymore. Okay? I skip the brushing technique because of the time, but if that, maybe next time I'll teach that. If you try to imagine but don't do, okay? Like a toothpick putting inside the gums. It should stop at some point really shortly, baby, 1 to 2 millimeters only. If you feel like, don't do, sister, if it goes beyond and beyond and beyond, it means there is no more bone supporting that tooth. Meaning the infection eats the bone already. I'm just using simple terms, okay? It's the bone and it's not holding the tooth anymore. It's just the gums. That's why sometimes you feel like, doctor, I don't have any tooth decay. But whenever I touch my teeth, you look, they will show it to me. It's so funny. You look, doctor, it's moving. It's so funny because it's really moving. It's not painful. Again, pain is our best friend. It's not painful, but it's moving. So, to answer your question, it's not just gingivitis most of the time. It's periodontitis, and you need to do deep scaling or surgery on the gums for this. They will open the gums, clean there, and then put it back. More severe, more expensive, but it's worth the price, okay? So, thank you so much for that. I hope everyone learned something today and hope that you need to visit your dentist. There's one more.
Sister Melly, this is almost 17. I'll allow you to have a one-to-one chat with her. We need to prepare a few things and we need to release her.
Yes, I still have to go back.
Yes. Otherwise, thank you so much, my sister. And we are looking forward to meeting you on Wednesday night. You're sleeping. You will sleep here on Wednesday.
We have to check because I'm not sure if I'll bring the babies. If not, then maybe I'll just go in the morning.
Okay. What time did you...